Hey guys, this is a YouTube channel that focuses on teaching high yield medicine concept under 2 minutes, or at least I try to do so. Now I recommend you to watch this video at 1.25x speed or 1.5x speed, as I'll be drawing in between the video while I'm explaining the concepts. So first we'll be talking about myelofibrosis today, and let's go to the pathogenesis of myelofibrosis. The basic thing what happens in myelofibrosis, the story starts with atypical megakaryocytes or clonal proliferation of megakaryocytes, or these basically clonal megakaryocytes are nothing but the big daddies of platelet cells which make platelets. So there are this type of atypical megakaryocytes which suddenly start secreting this factor called as transforming growth factor beta. And when they produce this transforming growth factor beta in the bone marrow, now see, all this is happening in the bone marrow. So in the bone marrow there is already fibroblasts, and when the fibroblasts see this transforming growth factor beta, they will produce collagen. And now this collagen, now it keeps on accumulating in the bone marrow. And so what happens in any body part where there is excessive of collagen deposition? So fibrosis, so bone marrow fibrosis. And now what are the normal inhabitants of the bone marrow? The normal inhabitants of bone marrow, see, I told you fibroblast stays in the bone marrow. The other cells that stay in the bone marrow are the hemopoietic stem cell, the hemopoietic stem cell. Now these hemopoietic stem cells say, like, man, we do not have enough space here in the bone marrow to properly execute our functions, to properly divide and to properly make red blood cells. So what they do is, like, they're like, screw this shit, I am going to some other place. So they go to other places which can accommodate them, and that happens to be the liver and spleen. And they perform hematopoiesis in liver and spleen, and that is called as extramedullary hematopoiesis. But this hematopoiesis which occurs outside the bone marrow is not as effective as the one that happens inside the bone marrow. So for example, I'll give you the example in the making of red blood cells. Suppose if you have a normal bone marrow, the red blood cells what are produced in the normal bone marrow, they come out to be pretty normal. And suppose you have red blood cells made in the spleen, or suppose you have red blood cells made in a fibrotic bone marrow, the red blood cells produced in such conditions are known as dacrocytes. They are basically teardrop cells. They have this shape, the shape of a teardrop, and you see them in microscopy. What I like to imagine is that there is a little space for the red blood cells to actually come out of the spleen or come out of the fibrosed bone marrow. So they end up assuming this shape. That's how I remember it. So one hematological abnormality you see in extramedullary hematopoiesis is the presence of dacrocytes. So this was how the pathogenesis of myelofibrosis happens. Now let's go to the manifestations. What do you see on a clinical level? If we go towards the manifestations, what happens is there is severe fatigue, there is hepatomegaly, and splenomegaly, because these liver and spleen they now are doing the function of the bone marrow, so they have to grow in size, and sometimes the spleen can grow so big that it can compress the stomach, so big that it compresses the stomach. And since this what do you call hematopoiesis is not 100% a good hematopoiesis, a perfect hematopoiesis, so you'll see one or greater than one cytopenias in this condition. And I already told you about dacrocytes. Now another clinical sign you see or a finding you see is that a dry tap on bone marrow aspiration. Dry tap on. Why that happened is because you put the needle into the bone marrow and you aspirate, and there is fibrosis in the bone marrow, so you don't get any marrow on the aspiration of the bone marrow. So that another is a sign of myelofibrosis. And myelofibrosis could be because of unknown causes when it is called as primary myelofibrosis, or there are some studies which say that myelofibrosis could be because of linked to some chemical exposure such as chemicals toluene or to benzene. So that was all about myelofibrosis, guys. Please subscribe to my YouTube channel for more content like this.